Manipal Hospitals, in collaboration with ARDSI, hosts Alzheimer's Caregiver Workshop. Manipal Hospitals, in collaboration with the Alzheimer's and Related Disorders Society of India ARDSI, conducted an Alzheimer's Caregiver Workshop at the MH Academy, Manipal Hospital, Old Airport Road, Bengaluru. The workshop was aimed at spreading awareness, educating families, and supporting caregivers of individuals living with Alzheimer's disease and related conditions. The event featured insightful addresses by two distinguished experts. Dr. Pramod Krishnan, Head of the Department of Neurology, Manipal Hospitals, Bengaluru. Ms. Renu Vohra, Chairperson, ARDSI. Speaking at the workshop, Dr. Pramod Krishnan emphasized the growing prevalence of Alzheimer's in India and highlighted the importance of early diagnosis, lifestyle management, and caregiver support. He underlined the role of neurology experts in guiding families through effective care strategies. Ms. Renu Vohra, representing ARDSI, focused on the emotional and social challenges faced by caregivers. She shared practical insights, resources, and coping mechanisms to ease the burden on families, while stressing the need for collective efforts in creating dementia-friendly communities. Manipal Hospitals has been actively involved in public health awareness initiatives, and this collaboration with ARDSI further strengthens its commitment to neurological health and caregiver empowerment. The event concluded with an interactive Kanda session, allowing caregivers to share experiences and seek expert guidance.
Depression, anxiety, many, their own health will suffer because they are not going to the doctor regularly, they are not getting the sugar and BP checked regularly. Okay, so all of that tends to happen. And even children have to know.
Today is 21st September and it is known as the World Alzheimer's Day. And this is an awareness program we have here at Manipal Hospital to tell about our disease and the prevention as well as what the society is doing. Now this society is 22, it was started in 1982 and now it has 22 chapters all over India. And so our mission is, it is very simple and profound. Simple is that we only want to take care and for the Alzheimer patients so that their life is made, they have a life with dignity. And also we take care of the carers as well as the family members. And so also we have a lot of awareness programs during the World Alzheimer's Month. Like there is one program here at Manipal. We have talks all over India in schools, colleges, and we have awareness sessions in the malls, and also we go to these what should I say, the senior citizen associations to educate them about the disease. But most important thing, we have to do advocacy with the government, because unless we cannot take care of 8 million people who are presently suffering from Alzheimer's, approximately, and unless our NGO cannot do anything. So we want the support from the government so we can tell them to make a policy. First, number one thing is awareness. Awareness is awareness about the disease, and also how do we modify our life to prevent the disease. Secondly, to have memory clinics and diagnosis in small villages and communities. Then also we go back, in the bigger hospitals in the cities, we should have new diagnostic tools to diagnose dementia and also for better care. So this is our purpose. And the most important thing, how are we going to take care of these 8 million people? So we need to create a very strong workforce so that each person is not neglected and taken care of. And this is my message to the people, to the government, that we have to spread awareness, have more memory clinics so that these people are diagnosed, and have caregiver training for the patients, for the carers of the patients, as well as, so that the stigma is not involved, and then people then go for diagnosis. That is the main thing. Go for early diagnosis. That's where we catch the disease.
Thank you, sir.
September 21st is observed as World Alzheimer's Day. Alzheimer's disease is the most common type of dementia. More than 70% of all dementia patients have Alzheimer's disease, and in India, almost 1 crore people have Alzheimer's disease. Alzheimer's disease mainly affects people who are above 65 years of age. And in our country, with the population becoming more and more older, we are likely to see more Alzheimer's patients in the years ahead. Fortunately, there are some very good tests to diagnose Alzheimer's disease, so we can make a very accurate diagnosis. And what is more exciting is that many new treatments are now coming for Alzheimer's disease, and we are expecting these treatments to be made available to our patients in the near future. Apart from these medicines, what is important is to provide emotional support to those people who are taking care of Alzheimer's patients in their house, because it creates a lot of stress, both emotional and financial, for these people. So on this day, all our efforts should be to ensure that our patients are properly diagnosed, properly treated, and the entire family is provided the care and support that they require. Thank you.